Okay, let's go ahead and get started. Good afternoon and welcome. This is exciting to be here, and we've got a beautiful weather for you to enjoy the ceremony. My name is Bev Cummins, and I'm the Vice President of Student Affairs and the Lincoln Campus Director of Southeast Community College. We are here today to commemorate the structural nearly completion of the Southeast Community College's new home of health sciences. This past week, our students, faculty, staff, administration, board members, and our community partners have signed one of the last pieces of the structural steel of the building. These signatures represent our community, the real strength of this building. Without every one of you, this momentous occasion would not be possible. Today, as we watch this beam put in place, we will see on top of it a tree that flowers in the spring as a sign of hope and regeneration. It also bears fruit in the winter to demonstrate resiliency despite a harsh environment. This tree will be planted in the healing gardens that will surround our building and continue to transform our campus and our community. Getting to this phase of the project has involved the hard work, expertise, and support of many, many people, and it's difficult to name them all. I would, however, like to recognize the amazing partners we've had the privilege to work with this past year. If you're here, please raise your hand. Project Control, BCDM Architects, Perkins and Will Architects, Olson Associates, Morrissey Engineering, and the Hausman Construction Team. I also want to thank Aaron Epps, SCC's Director of Facilities, who has taken on the enormous responsibility of leading the charge on SCC's construction projects. There are others here today who would like to share with you their thoughts about this occasion and the future of health sciences at SCC. We will begin with the visionary leader who put this project in motion, our president since 2014, Dr. Paul Illich. In the past 5 years, Dr. Illich has led significant accomplishments, including the opening of 6 learning centers, transitioning from quarters to semesters, and expanding our enrollment growth to meet the need of a skilled workforce in Nebraska. Please join me in welcoming Dr. Paul Illich.
Welcome to this incredible opportunity to really celebrate something very special. This is an amazing time for Southeast Community College as we go through a number of transformative phases. The event that we're celebrating today is the direct result of the implementation of our strategic plan to expand our capacity to produce a skilled workforce and to provide affordable access to higher education. But what I want to do first is I really want to recognize and thank our Board of Governors. So I'm going to call each of their names. Where's Nancy? Oh, there he is. There she is. This is Nancy Syme. She's our board chair. And Nancy, if I can have you stand up. And then Dale Cruz is our treasurer. And Kathy Borstoff is our secretary. And we also have a couple other board members. We have Dr. Ellen Weisinger. And then we have Jim Garver. Oh, sorry, Steve. And we have Steve Ottman. You know, there is no way that this project would have happened was it not the fact that the board embraced and supported the strategic plan with courage, vision, and commitment, not only to SCC, but to the entire 15 county service area. So I really want to thank them. Let's recognize them one more time. So Nebraska is facing a shortage of skilled workers in many high-demand areas. SCC produces about 16,000 graduates every 10 years, and we're producing them exactly in many of the places where we also have shortages. The Nebraska community colleges are perfectly and uniquely positioned to address this barrier to Nebraska's economic growth by expanding our capacities to produce career and technical graduates. The Nebraska Department of Health and Human Services projects a shortage of about 4,000 nurses by 2020. Today, we are celebrating the construction of a new 82,000 square foot health science facility to support all 16 of the health science programs on the Lincoln campus and to directly address this skills gap that exists here in Nebraska. I absolutely believe this. I'm convinced this is going to be the highest quality, most sophisticated health science training facility that you'll find in any community college in the United States. I thought everyone would clap to that. I'm a data person. I don't normally say those things, but I feel like this N of 1 is probably correct. So the new facility will include innovative classrooms, interactive simulation and lab spaces, creative outdoor learning spaces, including a healing garden. Jill Sand in just a minute is going to come up, and she's our Dean of Health Sciences, and she's going to provide additional information about the interior spaces associated with the facility. I do, though, at this time want to thank Jill Sand. Where is she at? Oh, there she is. And I'd like for any of the faculty in the health sciences that are here to raise their hand. Wow. So Jill and the faculty members went all over the Midwest. They looked at all different types of new health science facilities, and they studied what worked, but probably just as important, if not more important, they studied what didn't work. All of that work has gone into the design, so they have done a fantastic job. The new health science facility will allow Southeast Community College to reimagine its Lincoln campus in a very unique and innovative fashion. The design team, and this was, I think, very unusual for them, they were asked to construct the new facility with the understanding that it would set the stage for transforming the college and all future expansion. So this is truly a very unique and special opportunity. I do also believe the facility will change the landscape in the health science industry in Lincoln as well as throughout our 15-county service area. One of the wonderful features about this particular facility, it's designed to be a hub. It will have very advanced distance learning capability that will allow us to broadcast our programming outside of Lincoln into all of our rural county service area. We have 6 learning centers. All of them have at least one health science base space. So again, this is much more than about Lincoln. This is about the entire 15-county service area. The new facility will also position SCC to meet the growing demand for skilled health science workers, not just now, but for the next several decades. The last thing I want to close with is what was really special about this project is very specific drivers were chosen for the design. So these are the drivers: innovation, collaboration, empowerment, well-being, and adaptability. These drivers will ensure our graduates are not only skilled in their respective health science area, it's going to absolutely ensure that they're leaders for their employers and for their communities. So once again, I want to thank you for being here for this very special celebration, and thank you for your support for SCC. At this time, it is my privilege to recognize our board chair, Nancy Syme, who has over 40 years of experience in education. Let's welcome Nancy.
That was short. That's much better. Thank you. On behalf of the Board of Governors, I want to thank you for being here today. This building represents a lot of hard work and planning with many obstacles that had to be overcome. But with our strategic planning, we are here. And it is important to always dream big and overcome those obstacles. As you know, as Paul said, I was an educator for 40 years, so I always have to use a book for when I speak. And I chose Olivia, which is a little pig, and Olivia's book is Dream Big. And I think it's very appropriate today that we continue to dream big and overcome our obstacles and follow our strategic plan. I'm not going to read you the book, but I'll read you 2 specific quotes that Olivia likes to say. The first one is from Larry Niven. Everything starts as someone's daydream. And this did start as a daydream or a real dream. The other one is by J.K. Rowling. Anything's possible if you have enough nerve, or I say courage. So we need to continue to dream big and support SCC. So thank you. Oops. I forgot to introduce Jill. Sorry, Jill Sand Jill Sands is our Dean of Health and Science. How's that?
Good afternoon and welcome to this amazing celebration of the future home of SCC Health Sciences. It has been exciting this past week to watch SCC students, faculty, and staff sign the beam, leaving their mark. This building is a progressive sign of growth for SCC, not just in numbers and size, but also in campus culture and innovation. I join Bev, Dr. Illich, Nancy, in thanking those who continue to be incredible supporters of this project and SCC. SCC Board of Governors, it's good to see you all here today. Thank you so much for your support. Your vision of this building is greatly appreciated. On behalf of Health Sciences, we thank you for leading the way. Dr. Illich, thank you for being a transformational leader who models the SCC core values and lives out our mission and strategic goals every day. I hope you know the impact your commitment and passion to this campus and this project is having on the SCC community. To Bev Cummins, to Dennis Hedrick and the administrative team, thank you for being leaders who make it easy to follow, who invest in their people, on their teams, so buildings like this can be supported. To the design and construction team, so many of you have become dear friends. I appreciate your support on this building, and it has been neat too. I appreciate your hard work, your creativity, and your collaboration. I do hope you realize and get an opportunity to see the true impact your work will have on the students in the future. At SCC, I work with some of the best people, doing some of the most rewarding work. Thank you to the staff and the faculty at SCC for supporting this new growth on our campus. It takes a village, and we are one of the best villages to work with. A huge thank you to my health sciences team. I believe this building will allow you as educators to flourish as innovators, collaborators, and continue to enhance the excellent healthcare education we provide. Now let's talk about the building a little bit. The building will house the 16 SCC health science programs and will include a multi-level interdisciplinary center for high-fidelity simulation, 10 innovative labs specifically designed for each program, collaborative faculty hubs supporting interdisciplinary education, and distinctive learner collaboration spaces to study, play, reflect, and grow. The Discovery and Healing Garden will provide a space to learn holistic wellness, reflect, and connect with nature and with others. In addition, the advanced collaborative learning technology will connect across the 15-county area, making healthcare education available to many who otherwise believed it wasn't an option in their past, making a path to possible. This technology will enhance our online healthcare programs like polysomnography, surgical technology, radiology, and respiratory care. The result is providing high-quality workers in a time of healthcare workforce shortage, increasing enrollment, and the ability to serve our community like never before. This building will be a community asset, supporting our healthcare workforce, and a community resource, providing continuing education to graduates and community members who seek to advance in their professions. But as I look at the beams in the concrete each day, I glimpse hope and changed lives. For many of our students in health sciences, the degree they achieve here at SCC truly changes their lives. The experience of learning in this new building will support them as they learn to advocate for themselves, gain confidence, and build a positive support system that some of them have never had before. And in their lives changing through the learning that will occur in this new building, it equips them and prepares them to change the lives of others. So walk with me through the building and let me share with you what I see as I look at the amazing space. On first floor, the versatile EMT paramedic lab will house an ambulance simulator. I see a student who will learn to respond to horrific trauma in their community and act quickly and confidently to save the life and function of a 5-year-old child who otherwise would have potentially died or been unable to walk. In the surgical technology lab, which includes cutting-edge booms and equipment to simulate an operating room, I see surgical tech and surgical first assist working alongside a team during a heart transplant to allow a father to see his daughter get married and meet his future grandchildren. In our radiology lab, it will consist of advanced imaging equipment for X-ray, CT, and ultrasound. I see a radiology student preparing for a future where they will perform imaging, identifying very early stages of cancer in a young mom, who then can receive early treatment and continue to raise her children and grow old with her husband. As I move on to second floor, we see the medical assisting lab. It includes exam rooms consistent with a medical office. I can picture a medical assisting graduate working in a clinic that serves low-income and homeless populations, providing exceptional patient assessment and care to a homeless veteran who otherwise would not receive medical care in our community for his wounds and chronic illnesses. In the innovative dental assisting lab, fitted with 8 dental operatories, simulating future workplace settings, I see a dental assisting student who will graduate and work in a pediatric office, assisting a dentist filling a candy-loving 8-year-old's first cavity with remarkable skill and care. In human services, listening labs equipped with advanced recording technologies and capabilities, they'll observe students practicing counseling skills. I see a future graduate working compassionately with a client who is fighting and winning their battle with drug and alcohol addiction. And this student celebrates each day the sobriety of this individual as they step into a healthier life. Moving on to third floor, in the healthcare services lab, equipped with patient care equipment and an ADA teaching bathroom, I see a nursing assistant who will work at a memory care facility, compassionately caring for a sweet elderly Alzheimer's man who does not have family who visits and spends his time in the memories of the past. Our associate degree nursing lab will include advanced monitoring and nursing equipment. I see a graduate working as an RN in a rural critical access hospital, caring for the emergencies, illnesses, and injuries of those in her small community. In the practical nursing learning environment, equipped with mid-fidelity patient mannequins, I can see a graduate working as an LPN in a hospice facility, working with a frightened elderly woman as she continues to weaken and leaves this world with dignity, surrounded by the ones she loves most. And then to the fourth floor, which the faculty call the penthouse. In the pharmacy tech program, pharmacy technician lab furnished with mock pharmacy, clean room, high-tech lab, and a hood room, I envision a bilingual graduate providing patient education on a new medication to a refugee family who has a sick little one. He provides that education in their native language so they can understand, making a new country that they've come to a little bit more like home. In the dynamic physical therapist assistant lab, which houses exercise equipment, tables, and treatment mats, I see a future PTA working with and encouraging a teenage baseball player as he rehabs from an injury he initially thought would take away the game that he loves. Our 2 medical lab technology labs house state-of-the-art analyzers and instruments. I picture a future MLT graduate identifying a rare microorganism and working alongside a physician to determine the best course of treatment for a farmer here in southeast Nebraska who has been sick and unable to maintain the land that he loves. And finally, in our respiratory care lab, equipped with 6 patient care beds consistent with a medical care patient care environment in a hospital, I see a graduate providing treatment, encouragement, and relief to a 14-year-old girl in the midst of a scary asthma attack, and helps her better understand her condition and how she can manage it. Each of these students who I can envision in the building are not only doing hard work to change themselves through the power of education, they are becoming change agents in our community. Through this new health science building, SCC will have an opportunity to graduate hundreds of change agents for years to come who will positively impact our society, healthcare community, and southeast Nebraska. For those of you working on this building, to those who have supported this building, and for those of you who will work and learn in this new learning space, I hope you see that the real strength of this building is you. By doing your part and showing your support, you have showered hope and changed lives, not just for the next couple years, but for decades to come. We are doing great things here at SCC. I am humbled and honored to be a part of this SCC community and the team working to make this building a home for future learners who will go into our communities and continue to change lives as they serve. On behalf of Health Sciences, thank you for being here today to celebrate with us together. Now it is my honor to introduce our student speaker. Kira Bohati is a current Student Senate Senator. She is a full-time associate degree nursing student and mother of 4. She has been with us at SCC since the spring of 2017. She has served as our 2018-19 Student Senate President, is actively involved in the SCC Pride Student Organization, and student representative for the Lincoln Campus Master Planning Team. She has plans to graduate in December of 2020, and we are anxiously awaiting that day. So please join me in welcoming Kira.
Thank you. As an associate degree nursing student and current student senator, I am honored to be here today. The construction of the new health science building has caused a wave of excitement across campus. It was the affordable costs here that brought me to SCC, but I have found that as the students and faculty and staff and administration, they have encouraged me on my 3-year journey here for higher learning. By expanding health sciences, SCC will be able to give students the same quality education and affordable costs with larger classrooms, improved technology, and better collaboration between our programs. As I watch the foundation being built today, I think of the future and how this is the foundation for the next generation of health science students. In conclusion, I want to thank the administration, staff, and faculty for their dedication in securing our future. And without further ado, if I can get a drum roll, please. Take it away, ladies and gentlemen.
pretty amazing to watch what skilled labor and the skills that Southeast Community College teaches to our communities. So another round of applause for the amazing work these gentlemen have done. Well, thank you again for joining us for this momentous occasion and the start of the amazing transformation of the 8800 O Street campus of Southeast Community College. We hope that you all please join us for a reception in the Course Restaurant. It's up at the top of the hill. We also have shuttle. If you'd like to take a ride up there, we'll provide transportation for you. But please join us for a reception in this momentous occasion. Thank you.